report examining the outcome of programs run by the Oregon Health Authority and the Department of Human Services shows there's a lot of work to do to achieve health equity based on race and ethnicity. Jolene Estimo-Pitt explains.
The state would like to be responsive, and what they decided, working with a group of folks from the tribal communities across the state of Oregon, is that we thought that the storytelling would be a good way to get the community involved in talking about health. And the state and the tribes would like to use this, what they call strength-based approach. So what we would like to do before we start talking about, some of the disparities and issues in health is that we want to first start with talking about what is health for us today. And once we can, get that distinguished, then we can start maybe talking about disparities from, more of a strength-based place.
The goal is to learn more about how healthcare and social service programs can better serve the Warm Springs community, but also how individuals can find ways to be healthier. It may involve looking to the past. From the KWSO archives, here's an interview with Adeline Miller talking about her childhood.
But we stayed home with Grandma, and we enjoyed it. She was one old lady that really taught my sister and I a lot. Somebody'd come to the house, she'd say, "You get up and warm up coffee, give them something to eat. Never leave anybody that's going to leave the house hungry. Always share something with your neighbor that comes." So, and my sister learned how to cook. And I remember her biscuits being as hard as a rock, and my uncle would get it in powder on table on the floor. We ate on the floor. We didn't eat on the table. The floor was our table. People were like that in all their homes. They prefer eating on the floor. And she said, "Yay, this is good." He'd have to soak his bread in the coffee to eat it. So when it got around to me, "Now you cook something. You cook mush." I cooked a bowl of mush. Time to eat. He got that bowl, dumped all the mush into his bowl. Look, it's empty. So I had to get up and make another bowl. I didn't have to measure anything. I was just really giving it a try, though. But he wouldn't laugh at us. He'd compliment us for trying anyhow. And I guess that's why we continue to do until we finally did get to know how.
Thinking about healthy living, healthcare programs, social service programs, and thinking about how we can all do a better job with prevention and education. From the KWSO StoryCorps archives, here's an interview Liz Smith did with Elise Bagley. In this segment, they talk about planning for children.
It's kind of funny because my mom, she asked me if I wanted kids, and of course my grandma wants a lot of grandkids, and I'm like, I don't know, I've got a lot of brothers and sisters, and I watched my mom have my baby sister Marie, and that was something. I wasn't expecting to see that. I was about ready to leave the room, and the nurse shut the door and just closed the curtain, and she's like, "Can you sit down, please?" And I'm like, "Yeah." You're stuck, huh? Yeah. I'm sitting there, and I'm just peeking, and then you just see her, and then she's all, "Oh, Papa's coming." I'm like, "Oh my gosh." I was looking out the window. How old were you? I was 14. I was like, "Oh gosh." And my mom's all, "So you want to be a teen mom now?" I was like, "No." No.
Healthcare and social service access, and thinking about how we can all do a better job with prevention and education.
So I think that the local programs here are also trying to make these similar changes. Our local Joint Health Commission, they have also identified prevention as being a primary goal of theirs. So I think that this report is going to be able to help us locally in trying to address some of the health disparities within our community.